EbD Metrics Framework. And you'll note that this is being recorded, and we plan to post this recording and the slides, although there aren't very many slides, in about a week or two on our website. So as people are joining, let me introduce this discussion today, and I'm really thrilled to have you all here. Perhaps we could bring up the slides, and I want to welcome you to Equity by Design in Clinical Research, the EbD Metrics Framework. My name is Barbara Beer, back one, and I am the faculty director of the Multi-Regional Clinical Trial Center. And I'm really thrilled to be launching this. It's been a tour de force and an act of love for the last year or more. We're going to launch the metrics framework and have some discussion afterwards. I want to mention on the next slide the disclaimer, which is that we are all expressing our own opinions, and we are serving in our individual capacity, and the US FDA, NIH, affiliated organizations or entities, Harvard, Brigham and Women's Hospital, are supportive of our work, but do not endorse the views that we're reflecting today. We are supported by voluntary organization contributions and grants, and you can see that on our website, and we're committed to autonomy in our research, and we make our work fully available under a common CC license, which you can read. Next slide. I do want to say that we will be having a discussion. First, I'll be giving an introduction. I just introduced myself. Then Willianne DeCormier-Plusky, the program manager at the Multi-Regional Clinical Trial Center, will be giving an introduction to the EbD Metrics Framework. She spent much of the last year working on this with collaborators whom you will hear from and she will introduce, but want to real thanks to the team at the MRCT Center and the Roundtable, and specifically Laura Maloney, Sarah White, and others. We're then going to have a panel discussion featuring Yasmin Long, the director at Faster Cures, a division of the Milken Institute. She has served with us over the last year, but longer in spirit on the EbD Metrics Roundtable. And then Dr. Rodrigo Garcia, who's the Vice President of Patient Solutions at PPD, part of Thermo Fisher Scientific, but really a global CRO and responsible for many of the diversity efforts there. We'll introduce them in a minute. I do want to say that this is being recorded and we will post the recording in the slides. Please put any questions as they occur to you in the question and answer or the chat. It's easier for us if you put them in the question and answer to follow along. It is also being closed captioned, and you can turn that on in your enablement buttons below. Next slide, please. So I just want to give a mention to the MRCT Center and the current work in diversity and equity and inclusion. Next slide. We have worked on this for a significant amount of time, but the MRCT Center is really a research and policy center at Harvard and the Brigham and Women's Hospital that's dedicated to the integrity, safety, and rigor of international multi-site, multi-regional clinical trials. And we do this work by identifying emerging issues or unsettled issues and unresolved issues in clinical research, and then pulling together really diverse stakeholders, industry, academia, nonprofits, patient advocates, regulatory representatives, government officials, journal editors, whoever's involved in the question at hand, to really both define the issue, see what would be helpful, but not just stop at a here's what the problem is, but really try to find practical, actionable, and ethical solutions to the work, and then make those available to everyone. And we appreciate that, our first efforts are not our last efforts. We're going to continue to iterate and improve on the resources that we develop with our army of volunteers and enthusiasts. But nevertheless, we have to start somewhere. And if we don't start doing, we can't get better. So with the next slide, please. We've been working on diversity, inclusion, and equity really since 2016. Started that work when we had very good data, really cementing the fact that we were doing such a poor job of representation in various aspects of diverse representation in clinical trials: race, ethnicity, sex, gender, disability or accessibility of those trials, age at either end of the age spectrum, multi-organ dysfunction, and rural-urban representation. And we really wanted to see what we could do to address this. We had a work group of about 80 people working for about 3 years. And then the summer of the George Floyd murder, we presented the first iteration of the work. And that was, next slide, next click, also accompanied by a number of tools. We have since made a website available with the information and a toolkit. And you'll see that this is going to be the Equity by Design Metrics Framework is part of that toolkit, which is now available. We didn't stop at that point, but went on, next click, to really try to unpack all the different aspects of working on addressing diversity, inclusion, and equity in clinical trials, both with starting with participant and community engagement and education, thinking about workforce development so that we really empowered a diverse workforce and provided opportunity for growth. Thinking about the specifics of study design, eligibility, site selection, feasibility that really impact whether or not a trial is going to be available for everyone, and then study conduct, which of course is incredibly important. Data standards and analytics, roles and responsibilities, and then talked about genetics and real world data. Could I have the next slide? We took a pause and then started again with further issues in diversity and inclusion, specifically things like translation, the role of the IRB, all of which, disability, all of which is on our website for your review. We also have done a 6-part, next slide, training session, which will be available shortly. It was done live, but the training session is available now. And we have tools and resources for the IRB and investigators, next slide, or next click, and have worked on disability, next click, and really worked on health literacy and clinical research and have resources for that. But all of this depends on us being able, next click, to come through with a way of evaluating whether we're making progress or not. We can give and we can all believe in this, but unless we move from talk to action, and unless we understand whether we're making an impact, all of this is sort of good to have, but it needs to be implemented. Could I have the next slide? So with that, we really started to think about who's responsible for making change. And the more we thought about it, the more we realized that everybody involved in the clinical research enterprise, from sponsors and regulatory agencies, CROs, research institutions, PIs, and their study teams, healthcare professionals, the providers, community-based organizations, the participants, ethics committees. Everyone has a role and everyone can make this better and can really commit to doing things differently tomorrow than we did yesterday. That learning from each other, listening to each other, really thinking about how to make this real in the work you do every day requires transparency, what works, what doesn't work, what should we know, what haven't we thought of, how do we approach this? And it takes us working together, talking together, and learning from each other. But we also realize that it takes a real rigor of measurement, tracking, and reporting, so we can know not whether we think we're doing better, but whether we are doing better. And that involves a really holistic approach to the evaluation of diversity inclusion, and then importantly of equity and justice. And what you'll hear today is the efforts that we've had to create a framework which is intentionally broad. It's intentionally available to all organizations, not just to clinical trialists or to clinical research, but all organizations dedicated to clinical research and changing this, to think about what are we working on today, what can we measure, how can we understand what is important for making change, track it, improve it, and move forward. So with that, let me turn it over to Lillian DeCormick-Pusky, and she'll introduce the framework for you. Thank you.
Thank you, Barbara. And thank you to everyone who's taking the time to be here this afternoon. It's wonderful to be here with you. My name is Willie Ann DeCormier-Plasky. I am a program manager at the MRCT Center. I'm presenting this work on behalf of the team at the MRCT Center, which includes Laura Maloney, Hayat Ahmed, Sarah White, and Barbara Beerer. Next slide, please. So I wanted to give you a little bit of the background into the Equity by Design Metrics Framework. As Barbara mentioned, kind of the impetus was the inequitable participation in clinical research and inequitable health outcomes, which were well known, but became much more clearly prominent during the COVID epidemic. She did show the Diversity, Equity, and Inclusion Guidance document, which was published in 2020. It includes also an extensive toolkit. For those of you that have not seen it, it's about 400 pages. It can be downloaded from the website here or purchased from Amazon. And then really, just as Barbara was saying, so we had all of this momentum and lots of great discussion around diversity, equity, and inclusion, but really trying to think through how do we move forward in terms of actionable approaches. So next slide, please. So following the publication of the guidance document in late 2020, the MRCT Center convened representatives of professional, academic, and patient advocacy organizations to form the Diversity, Equity, and Inclusion Roundtable, which we'll just refer to as the Roundtable kind of henceforth. So the Roundtable really expressed a need for better planning, goal setting, and understanding of processes for accountability, particularly for accountability and transparency in diversity, equity, and inclusion, and expressed that there really aren't available metrics at the moment that can provide guideposts for measurement and comparison of progress on diversity, equity, and inclusion. Next slide, please. So I just want to here give recognition to the Roundtable. You can see here listed the organizations that were participating in the Roundtable. And to note, as just the disclaimer from before, that this participation was in their individual capacities and not representative of an endorsement from their organizations. But just to say many thanks to these organizations. We also had several external organizations that also helped to review the metrics framework as well. Next slide, please. So how did we kind of begin this process? one of the ways is that we really kind of went back to thinking about really what do we mean by diversity, equity, and inclusion. And I actually really love this slide because I'm a visual person, and I find it very easy to see where you kind of have the little guy in the blue jumper and the guy in the red jumper, and you can see how, one is getting the apple, one is not. And really, so we have kind of these measures to move towards equity, where you see kind of putting in the ladders and the different size ladders so they can actually reach, one can reach more apples, one less. But really, we want to think about, we're really trying to move towards justice. And you can see where this tree gets righted, and both have equal access to the apples on the tree. And I just think it's a great representation and something always to keep in mind, that really we're trying to think through not just short-term goals in terms of progress, but also what are our long-term goals. Next slide, please. So as we worked together with the roundtable, we kind of brainstormed lots of different metrics. And I would say some, kind of looking back to the analogy in the past slide, were really forests, like very large encompassing measures. Some were trees and some were leaves, very kind of, specific measures. We did recognize that we needed both quantitative outcome measures and then qualitative measures to kind of show, okay, you have this outcome, but how do you get there? So we really need to kind of identify the steps of that process. So we kind of brainstormed this all, we put it into this beautiful Excel spreadsheet, shared it with the roundtable, and they kind of diplomatically said, oh my goodness, too much. Like, this is just a morass of measures. So we kind of said, okay, great, thank you for the advice. This is incredibly helpful. Back to the drawing board. Next slide, please. So we really kind of took a step back and reoriented to thinking about really what are our key themes within the diversity, equity, and inclusion kind of process. So we developed the 7 key themes that you can see on the slide. They start with commitment, leadership, and resources. We call these kind of the foundations, institutional and study metrics for diversity, equity, and inclusion in clinical research. 360-degree partnerships and communication. Really, if you don't have that community engagement, it's very difficult to kind of get this process moving. Then on to educational and career opportunities, which we really call kind of workforce development. Strategies for inclusion of diverse participant populations, which is really around things like, developing your study protocol and eligibility criteria and all of those kind of processes. And then really kind of bringing it around full circle into reviewing what you've done, what your measures are, assessing if you've had any kind of negative externalities, developing lessons learned, and then really how are you going to disseminate this out and advocate for progress in the future. So next slide, please. So you can see that one of our biggest challenges actually during this process was to try and figure out how, okay, so we have a number of these measures. As you'll see, once you open the framework, eventually it's extensive. How do we communicate this and develop it in a way that is digestible to different audiences? So we basically put the metrics framework into layers. So what you can see first on the screen is the kind of topmost strategic layer, where we have these 7 key themes. Underneath that, we have an additional layer, which is going to get into the what we call tactical level measures, which are really kind of breaking out the bigger strategic level measures. And then we get into more detail as we go through. We also really needed to develop kind of a graphic representation of what this meant so that people can share it and say, oh, we're really interested in diversity, equity, and inclusion. Kind of here's a snapshot, so it's not super overwhelming. So we developed, you can see this kind of wheel on here, this equity by design. This is kind of the branding for what we're going to be doing. We really thought about developing a clinical research community, so you can kind of see the house and kind of how each part really starts to shape the construction of that community for diversity, equity, and inclusion. So we have the strong foundations, the clearing paths, and assessing and re-engineering. Finally, we also developed a user guide that we'll be putting on the website, or it is on the website actually, which is launched today, to help kind of people navigate through the metrics framework, because it's not, we tried to make it as intuitive as possible, but probably it does need a little bit of guidance as you walk through. Next slide, please. So as you get into the metrics framework, you will see that there's one theme per page. We did that so that you could see kind of everything for that theme at one look, for people who like kind of a snapshot view. We developed quantitative measures that are below the theme. There's currently only 4 of the themes have quantitative measures, but we are working to see if maybe we can develop them for all of the themes. Just to note, quantitative measures that are listed in the metrics framework are not a one-to-one relationship with the qualitative measures. So basically, if you have a quantitative measure, for example, in theme E, which is around inclusion strategies, that says number of participants screened, and you have another one that's around number of participants retained in the trial. Really, those measures are an outcome of many different processes that are going to be the qualitative measures. So you can't really have one specific one-to-one. We also give examples of potential ways to kind of break down the quantitative variables. So you can see, for example, if you're looking at people screened, you could disaggregate by age, race, sex, gender identity, for example. We also put them into categories: regularly collected variables and additional variables, just so it wasn't overwhelming. And then we have qualitative metrics at 3 different levels that are increasingly more specific. These measures are intentionally broad, so all stakeholders can use this metrics framework. And they are not set in stone. I just want to say that from the outset. These measures are not meant to be something where you take this guidance or you take this metrics framework and say, I must do exactly what's written here. They're really guideposts to kind of guide thinking and prompt thinking around what measures you could potentially use. Next slide, please. So forgive me for kind of a lot on the screen, and this is a little bit of a snapshot of what you would see on a page. So this is theme E. You see that the theme name is listed at the top. Then we have a description of the theme, which I've abbreviated for this slide. But basically the description says what is in that theme and what's in other themes, because a lot of the feedback that we got was people would say, great, I'm looking at this theme. Why isn't X, Y, and Z in there? And so it gives kind of a preface that some things are in other themes. And then below the description, you see the quantitative, some of the quantitative measures and some examples of how those could be disaggregated. Below that, we have the strategic level of the qualitative. So you see the kind of main level there for E1. So study protocol drafted to be as inclusive as possible. They're broken out. Each strategic level measure usually has 2 to 3 tactical level measures, kind of really break it down. And then we get into what we call the operational level, which is really getting into more of the details for people who are in the operational side of this, who really want to go into the details of how you get to these qualitative measures and quantitative outcomes. So in the metrics framework, we have one example per theme of how you could do one of these operational level kind of breakouts. So next slide, please. So how we ended up doing this is we created standardized prompts that kind of drill down in a logic model format from the quantitative measures and the tactical level qualitative measures associated with those. So really trying to generate thinking about who in your organization is responsible for that process, who they are engaging with, which is incredibly important, particularly when you're working in community engagement space. What micro level budget you're using, so not the whole institutional level, but really kind of which specific resources do you need to get involved? What actions are you doing to support that, the development of that product or process? What the metric is focused on, and then where the intended audience will engage with the what. Next slide, please. So you can see here's an example of how this is broken out. On the left, you have the quantitative outcomes. going into thinking, drilling down into the qualitative outcomes and measures. And you can see here we have eligibility criteria we're focusing on, and really thinking through all the way back into what we're talking about, where you engage with the eligibility criteria, what kind of activities, and then who would be involved. Next slide, please. So the metrics framework has been posted today to the MRCT website. It's brand new. You can go to the website and you can find the metrics framework, the user guide, and then there is a blank editable PDF of the operational approach example. We would absolutely love everyone to test the metrics framework, to develop their own operational approach examples and give us feedback about how this is working for you. Lastly, just to note that we're going to be working to create an interactive web version of the metrics framework, where you could go into that circle you see on the website, be able to click on the different themes and then drill down from there, and really also have resources, for example, to support some of the information that's in there. Examples, for example, how other organizations have done specific parts of the metrics framework. Thank you. I'm going to turn it back to Barbara.
Thank you so much. So now we're going to move to a panel discussion. So, you know, I think it's just to remind you to please put your questions or comments in the Q&A or in the chat, and we'll try to get to them. But let me start by asking Yasmin, who's the director at Faster Cures and the Milken Institute, to introduce yourself, sort of your role and what the Faster Cures has done to promote DE&I and what you're working on, but also really want to thank you for all of the work you did with us on developing this metrics framework, as the rest of the roundtable. We appreciate. Yasmin?
Well, thank you, Barbara. So good afternoon, everyone. I'm Yasmin Long, I'm the director at Faster Cures, which is a center of the Milken Institute. And the Milken Institute is a nonpartisan nonprofit think tank. At Faster Cures, I lead our portfolio of work focused on achieving health equity across the biomedical research ecosystem using a multi-stakeholder approach, including how we approach diversity in clinical trials, how we invest in research, community engagement, also health research workforce and that pipeline, and then engagement with policymakers. About a year ago, we convened an advisory group of experts across stakeholder groups and developed an action plan for researchers, including academic researchers, patient advocacy organizations, funders, disease-specific organizations, biopharma, and federal agencies. And our focus now is to think about how we will implement that action plan and recommendations that we developed in late 2021, and how that can be implemented into practice and processes for maintaining these efforts for the long term to achieve diversity in clinical research and trials. So, you know, I'm very proud to have served on MRCT's Roundtable Planning Committee. It was a fantastic experience and really a great resource for this work. So I think this framework is really an innovative approach for standardizing this process. And I think the framework provides a mechanism for not only just measuring equity, but how this can support how researchers can demonstrate the impact of DE&I in research, and also serve to measure accountability to maintain these efforts for future research and protocol design. So I'll pause there.
Thank you.
Back over
Thank
to
you. That was perfect. And Rodrigo Garcia, let me introduce you. And just for the audience to know, Rodrigo is one of the people whose team, led by Rodrigo, really put the framework to the test and tried to apply it, and is here to say that he survived and to tell the story. But let me first ask you to, if you could, introduce yourself and what work PPD is doing in this domain.
Sure. Thanks, Barbara, and thank you to you, Willian, and the MRCT team for giving me the opportunity, as you said, to test the model and to just contribute on a theme that obviously we're all very passionate about. So my name is Rodrigo Garcia. I'm the Vice President of the Patient Solutions Group within PPD, part of Thermo Fisher Scientific. And, it's, my team and I, one of my functions within my team is exactly to bring diversity of patients in clinical trials. I'm extremely proud that my team, is completely diverse, is coming from the sponsor side, just like myself before joining PPD. We also have people who are coming from the site perspective, that they've been there, done the work. They are, in some cases, some members are registered or a licensed social worker. For us, that's extremely important because we need all different perspectives. Um, what we do is we want to work very closely with all the key stakeholders, obviously internally within PPD, but also externally with the sponsors, with the sites, and obviously with the academia, with the experts like MRCT, because we might have great ideas, but we learn substantially when we actively listen and we learn from the subject matter experts and from the organizations that are driving this. In the case of the framework, obviously, I'm a big fan of the logic model from MRCT. I've used it before for putting together the strategies related to diversity. And I like how it takes you, virtually hand in hand, and it walks you through the process. And when I was approached by MRCT to say, would you be open to go again through the journey now with this new toolkit, I obviously said absolutely. And I'll share my experience. But I would say it resonated very well with me, and it confirmed that everything that we're doing at PPD is, how we're doing it makes sense, but you have to look at it from different perspectives. You have to look from who is going to do this, when, how are you going to measure success? And so we're constantly challenging ourselves at PPD when we're working with other individuals, other stakeholders, but having the opportunity to use this framework has been a fantastic experience. So I survived, but I love it. So thank you again, Barbara.
Thank you. So maybe you could unpack it a little bit, and we'll start with you, Rodrigo.
Sure.
How did you take it and how did you really apply it? What did you find useful? What metrics have you, and then maybe more generally, although we could come back to this, what metrics have you used in the organization to see how you're doing?
Sure. So as as William mentioned, there are the different themes. And then I was drawn immediately to two themes. Obviously, I'm totally biased towards those two themes. One was all about the metrics, and the other one was about being strategic, right? Which is the theme E, strategy, how you're going to do this. So how I apply it is, as we saw in the introduction, right? It has the quantitative, self-explanatory, then the qualitative. And then about the qualitative ones, we have the strategic, tactical, operational. And it really tested me to think strategically. Okay, for example, for the theme E, for the strategies. Okay, study protocol design. Okay, it focuses on study protocol design, how we're going to do this to make sure we're being inclusive. So, that sounds logical. Okay, but then the model takes you to, okay, now let's get tactical here. This is how we recommend you think when we're talking about protocol design. And then, as William was saying, not everything is set on stone, but it takes you to say, well, from protocol design, let's start from the beginning, and then let's go to with an end-to-end mindset. And once that you do that, okay, tactical is great, but let's take it to another level now, operational. What do we truly mean if you're going to say that the study design is really going to be patient-centered? So the document helps you to say, that's important, of course, but how are you going to do it? And more importantly, who are you going to bring? Because, in my case, and I'm sure everyone understands, I cannot accomplish everything on my own. I need to work with my team. So I'm going to need, and something that I like very much about the framework is it asks you, as William was saying, be a little vague, because not every company has the same titles. So we're trying not to put any titles per se, but we're trying to say, at least you should consider which organizations should be involved to enable you to have a successful, inclusive protocol design. But then not only that, it says, okay, if you're going to include these different functions broadly, what are you going to be asking from them to help you to do this? And then again, you can go very nitty gritty But again, it helps you not just to say, we're going to have a great protocol design, which is going to be very patient-centric and inclusive. Okay, how are you going to do that? Okay, this is how we're going to do it. Okay, and who is going to help you to do that? And then finally, and how are you going to measure that? So if you're able to follow all those steps, from my perspective, at least it's going to be easier internally and externally to have a well-structured process to implement and to learn constantly, right? So that's how I started to apply on the very interesting theme E, which is like, from my perspective, one of the most important one, which is the strategy for including diversity in the clinical trial. So let me stop there.
Thank you. That's terrific. And Yasmin, let me ask the same. What metrics do you use in faster cures, or would you recommend? And have you established organizational metrics, or how are you approaching progress?
Yeah, so I looked at it more from a sort of holistic and general approach as how an organization who conducts trials may approach this. So going through the framework, one of the main themes that I focused on was the strategies for inclusion of diverse participant populations in clinical research. And that theme was specific to the study process. So I'll speak from experience and testing that out using a holistic and general approach. But I focused on the following metric: study protocol drafted to be inclusive as possible, because this theme focuses more on the development of the strategies for implementation of DEI and design of study plans. So really gets you to think strategically on how to make this work, for lack of a better word. So I took a general diagnostic approach because we don't conduct clinical trials at Faster Cures. However, we do convene thought leaders and experts to advise our health equity and clinical trials portfolio. And this includes, how do we eliminate the barriers to clinical trial diversity? How can we support those organizations who are trying to achieve that, and really dismantle those barriers that prevent equity from being embedded in the research study design by thinking critically, and really the framework really breaks it all down, so to speak, so that you can really drill down those parts. I will say that my favorite part of the my favorite part of the framework, and one that I think will be the most helpful in thinking this through, is determining the whom and the what and the when and the how, and that's gone over. We go over that in the framework, but I think, at least in my experiences, really thinking again critically and strategically on who that is, who those partners are, who's going to execute it, how you're going to do it, and when, right? And really thinking of that all together. At times, at least in my experiences, sometimes that is thought of after the research or the protocol is designed, right? So really thinking that and that in the beginning process, and then within the framework, the corresponding quantitative measures, such as the number of participants and additional, most importantly, I think the inclusion of additional demographic variables, including language, disability status, education level, income, whether the participant has health insurance or not. Those are variables that typically aren't captured. I think that they're very important in the analysis and disaggregation of data. So these variables, again, are not always captured, but the framework allows for the research designers to really think outside the box, so to speak, when addressing DE&I and the research process. I'll turn it back.
Thank you. That's really, really incredibly helpful. There is a question or a comment basically saying that Angie Chen just checked out the toolkit. It's amazing, with lots of practical tools to use. I can see already many of them that I can use directly in my daily work, and thank you. So not quite a question, but one of the things that I wanted to ask is, when we worked at the roundtable, I think I, for one, and some of us had a natural inclination to be as specific as possible, to say, okay, let's adopt this common set of metrics and everyone sign on to this. And that now we will, sort of march forward and learn, if you're more successful than me in this domain, what have you done that's better or that's different, and what can I learn? And as we work through this, we realize that every organization is different. As you said, Rodrigo, everybody is taking different aspects as the first piece that they want to work on. You know, some feel critically that you can't make progress until you've really attended to diversifying the workforce. Some feel that, you know, they can't make progress until they have the commitment of leadership resources to do the work. You know, some of these other things. So we stepped back and said, okay, you know, let's present something that is comprehensive, but really flexible and allows adaptation to all of the different audiences, organizations, entities, and individuals. But that leaves open the question of whether we think that there could be a common set of metrics. Should there be a common set of metrics? How do we help each other? We did not at MRCT Center and the Roundtable feel that it was our position to decide on those and say, okay, this is what we're going to say nationally. Every pharma company, every academic center, every community health center should sign on to, because that's not where we are as a society. But on the other hand, how do we now begin to learn what works? Is that always going to be an internal process? Big question.
Yeah. Jasmine, do you want to go first?
The answer is yes. That's the short answer. I mean, you know, and I'll just say this quickly so you can jump in, Rodrigo, but, you know, and when I mentioned in framework, when we talk about the, you know, the where, the whom, the how, the what, you know, I think, you know, one thing I really drilled down, I think the whom and with whom is, I think organizations can be rather successful on that, as well as the where. But I think the how and the what is really what's the challenging part, right? So, you know, thinking of, and again, we talked about community engagement, and these are internal and external conversations, but internally thinking of, you know, one, not just reaching out to communities, but establishing those relationships, establishing that rapport, and establishing that trust, so that it's a you know, a collaborative process. So, and they bring their significant expertise that I believe should be valued. So obtaining their feedback on the design of the research, you know, the eligibility and eligibility criteria. And again, initiating that community engagement piece earlier in the process. And then also thinking on this sort of accountability side is having research grant award review committees hold researchers accountable for ensuring that community engagement is required in the study design, and not community engagement where there's just bobbleheads at the table, like going in and developing relationships with these leaders and building that over time. I think that's part of the how that can be challenging, but really has to be thought out. And then the what includes, you know, just listening to lived experiences, right? What do you need to be able to participate in research? What would be most helpful for you, and how would you disseminate that to the community and listen to those barriers? And then, you know, depending on where an institution is, let's say an academic institution, for example, you know, investigators may have direct contact with community leaders and can already establish that rapport and trust at the start of the research, at the beginning of the research development, not once the protocol's been completed and it's like, oh, we didn't think about that. No, when they're thinking of writing the grant, that's when you want to think about that, and being intentional with targeted engagement focused on empathy and understanding and lived experience of community members to be a part of that research and establish that trust. So those, the how and the what, I think are really important aspects of the framework that I think really can help organizations and researchers really drill down what that process should be so that it's authentic and genuine. That's a great perspective. Thank you so much. And Rodrigo, do you want to take a?
Yeah, sure. The great question is very difficult. Obviously, as you said, Barbara, I think our role, I would say, is to ask the questions that maybe, you know, a lot of people, they don't want to ask the question within their organization because it's a difficult question to say, for example, you mentioned about the metrics and are we the ones determining which different data variables are going to be asked to patients or being gathered from patients about age, race, ethnicity. But from the CRO perspective, I see how different sponsors now they are taking it, if you will, more aggressively to say, no, those are the standard ones, but we're going to be a little more aggressive and we're also going to start collecting disabilities, veteran, etc., because it's part of that whole social ecosystem that we live and those social determinants of health. That's great. So I think there's a lot of still of variability, but at least I think the momentum is that people are starting to ask those questions internally. The framework, one of the themes that this talks about data and it talks about metrics. And one of the first key questions is, do you know the metrics within your organization, right? And I think that's the first question. If you're part of a sponsor, or if you're part of a CRO, or you're part of a biotech, or doesn't matter, in wherever you sit in this ecosystem, if you need to know how good or bad are our clinical trials right now from diversity perspective, and that will be the first key question, because sometimes in organizations you will realize the systems were not put together for answering that question in a simple manner. So then you have to start saying, okay, we have to make sure we're collecting this consistently. We start measuring this in order to determine where we are, and then we can determine where we want to go. So I think the framework again helps to start asking those questions and then to determine how good or in which step we are, if you will, from 1 to 10. And then you can start getting more targeted about, okay, we're going to start now collecting this. We're going to start standardizing our analysis, so we will know how good or bad we are, etc. So it's not our role, like from a CRO perspective, it's not my role to determine, but it is my role to advise sponsors, right? And about, this is what I recommend you do. Do you know this? Do you know where you stand? And now I see more and more sponsors at least saying, we're ready to have that conversation. We know we're good, or we know we're not there yet, but we know we're gonna get there. So that's really exciting to see that finally coming.
I want to annotate 2 points that you made that are embedded. One is that some of this data that we're collecting and recommending that we collect is not to power trials to compare differences. It's in order to make sure that everyone has access. It's a social responsibility. It's not necessarily a scientific question to say, are these different? So I think that's really important, because a lot of people will say, look, we're never going to have enough people with X disability in this, plus all of these intersectionality to do a scientific study on that. But nevertheless, we'll be able to say people had access, and there's nothing that we see. And over time, of course, if we're able to do what you say, to find common data metrics, we could have interoperable data and follow on real world data. So that's one point. The second point I wanted to make that you made so clearly is, at the end of the day, if a trial, let's say, has appropriate representation or doesn't, it's not one organization's success or failure. It's everybody working together. And therefore it's not, a pharma company that succeeds or doesn't, or an academic center that succeeds or doesn't, or a community that has enough power or doesn't. It's all of us bearing in to change this. So I really appreciate your perspective. So Willianne, did you want to say something, or I couldn't tell? Okay, so there's an interesting question here in the Q&A. To be inclusive of all stakeholders, or to include all stakeholders, how are quantitative measures best obtained, tracked by fiscal year or calendar years? And let me just answer the way I would answer this, and then see if, I think, as with many things, it depends what you're measuring and how you're going to use it. And that actually, sort of in a clinical trial, you might be measuring at each annual review, not necessarily either fiscal or calendar. If you're looking at an organizational performance and each member of your group has metrics that they are to perform to, they have goals, maybe it's at their annual review. So it's very much thinking about, what am I measuring? How am I going to use the measure? What am I going to do with what I learned from it? And how do I go forward from there? So I think that that's exactly what a great question to sort of illuminate why this is flexible in the way that it's flexible. And thank you for that question. One more question. Where do we need to go forward with this framework? What are the next steps? How should we deepen it? We've got some examples of logic models, but I wonder if, maybe I could ask Willie Ann to say what's on your plate as you think about it, and then we'll go to Rodrigo and Yasmin.
Thanks, Barbara. I think one thing going forward that would be incredibly helpful is, as I mentioned before, as all stakeholders look at the framework and start to digest it, to send back their feedback and let us know, are these measures in there? Are they comprehensive as one thing? Are they, speaking to, are they accurate measures that you would be using? Also, as you test out operational approaches and start to fill in the logic models, that process, and Rodrigo, I'm sure could speak to that, is incredibly instructive to understand, really, particularly for people are coming from all different kinds of perspectives, and really what they're looking at and how they're utilizing that is incredibly helpful. And if people would be willing to share their thoughts, through these, particularly the hows, as Yasmin said, in the operational approaches, we can, as we work to develop a web framework, we can, append those, anonymize them if need be, but append those and say, okay, here's kind of examples of how different organizations have been using this and thinking about it. And we've been thinking about developing a kind of like library of all different kinds of things you could kind of slot into your operational approach, framework, either different hows that people have used before, different whoms, that would be helpful to filling those out. So those are some of the things on our plate, like thinking about how to operationalize this. And I think the issue also of standardizing is an ongoing one, to be able to compare across, potentially across organizations, but it's going to be a little bit further down the road.
Yeah. Do either of you want to think about or address that?
Go ahead,
Rodrigo?
Yasmin.
Sure.
Or
Yeah,
Yasmin?
no, just kind of piggybacking off what Leanne said, and thinking about, well, one, I think the framework will be helpful, for us to use at Faster Cures as we continue to focus on implementation, policy engagement, and dissemination of impactful recommendations towards achieving health equity and diversity and inclusion in clinical research, and using that framework to, as Leanne said, to collect feedback from the research stakeholders in the ecosystem, right? I think that could help to standardize the process, but also, to go back to community engagement. I mean, when we think about participants and diversifying participants who are part of the research, who are enrolled in the research, but also us as stakeholders engaging with each other, right? And what methods work best? How can the framework be used to improve those methods? And again, I think the beauty of this is that it really gets you thinking in ways that you normally wouldn't think of before, and that goes back to the how, because people want to know how do you do this? How do you do that? But then I also think it's our social responsibility as well to engage with each other and determine, the framework works for this type of organization. It works for this type of organization. So a small little cohort of piloters, so to speak, that really help to not only show how usable and it is, but also determining that impact. And then I'll just say lastly that, right now, there aren't strong metrics to measure diversity, equity, and inclusion, right, and research. And that can be used as a mechanism to increase funding or for return on investment. I think that's where it can help align some of the incentives for researchers and organizations to do that as well. And sometimes I think that's a priority for certain organizations. So there are many great ways to use it, but I think that each organization, whatever their priority is, they're going to use it differently. But as long as there's an approach to be able to capture that information and analyze it for improvement, those metrics, I think it would be it is a helpful.
Thank you. It's a really good point. Thank you, Rodrigo.
I completely agree. I think from my perspective, they should just put it to the test. Use it, right? Use
Elizabeth Whitty.
Sorry.
Use it. No, it's okay. Use it and give it a try. Some of the things might not be 100% applicable, but I would say I would be surprised if you cannot apply 75% of the material, and it will guide you. And again, if some things might not be totally applicable, it's okay. If you cannot do the 7 themes right away, it's okay. At the end of the day, this is a journey. I would recommend people review it. They say, pull the number 1, senior commitment. Okay, we already have that. Perfect. But don't disregard it, because the document says, well, that's great that senior leaders said and they have a public commitment, but internal organizations, are they aware of that commitment? If the answer is yes, fantastic. They're going to be an ambassador to this work. If they don't, then you're going to have to educate them about the commitment coming from senior leaders. And this is why when we're going to the steps on site feasibility, this is why we have to invest extra time and effort when we're doing site feasibility, because it aligns to our commitment. So just give it a try, put it to the test, and I'm sure you will find it extremely useful throughout the journey of bringing diversity of patients in and health equity in clinical trials.
Well, what a wonderful way to end this. It's like such a great endorsement. Thank you. And I have to say that one of the things that I'm looking forward to is really all of us committing to long-term sustained change. We're going to need to figure out how to standardize the data and really respect it and educate the civil society on why it's important. It's not to use this against you, it's to use it to empower you, kind of, and working with one another to address the barriers that are beyond our control, things like insurance status. If we don't, as a society, address some of these questions, we'll never have access equitably. And if we don't have that, then we can't possibly ever be in a position of saying that we have achieved justice or equity in an appropriate way. And only by having that data together and sharing it in a constructive way, not a critical way. This isn't the kind of we've got you, it's how can we help you? And taking that perspective forward, it took us 400 years to get here. I trust it's not going to take 400 years to be better, but I don't think this is something we're going to see as a quarter-over-quarter result. And I really appreciate the depth of thinking that went into this. I want to thank you, Willianne, and the roundtable, and really appreciate, sort of both the work of Faster Cures in keeping this top of mind in, as a policy and practical challenge that we're going to address together, and being, among the leaders in making sure that we have a crisp message and continue to push on that. And organizations such as PPD that's really made the commitment to sustain change. So thank you. We look forward to hearing from you. Do check out the website and the toolkit, and Willianne is looking forward to your emails. Thank you.
Thank you.
Thank you.